Well, good evening, everyone, and welcome to tonight's webinar, Precepting a Win-Win-Win. I'm Caitlin McGuffey, Deputy Executive Vice President at the Ohio Academy of Family Physicians and the OAP Foundation, and I'm excited to be with you tonight for this presentation. We all know the need for family physicians is evident. One strategy in supporting the next generation and encouraging family medicine choice is prioritizing mentorship and precepting. This piece of the puzzle is critical to ensuring a strong, confident, and empowered family medicine pathway. In addition, one of the Foundation's objectives in its development plan is to increase the quantity and quality of family physician preceptors in Ohio. To provide support and education to our members, no matter where they are on the precepting spectrum, the Foundation is proud to sponsor tonight's session. There's also a dedicated webpage on the Foundation's website with helpful information, articles, tools, and more. I'll share a link to that in a post-webinar email as well as in the chat in a little while. So be sure to check that page out. As far as housekeeping for tonight, please use the chat box to communicate with fellow attendees or share your own precepting tips and tricks with each other. Use the Q&A box to submit questions for our speaker. I'll help monitor those, and depending on how things are going, we'll interject them as we go or wait until the end, kind of see how that goes. But we have allocated the last 15 minutes for Q&A, so we'll definitely be sure to get to as many, if not all, questions tonight. This session is also being recorded and will be available on the OAP website. If you have any questions as we begin, you can send me a direct message or put it in the chat. If not, I will introduce our speaker for tonight. Dr. Joanna Drowis is a professor of family medicine at the Charles Schmidt College of Medicine at Florida Atlantic University and practices at the Marcus Institute for Integrative Health. She previously served as Associate Dean for Faculty Affairs and is Associate Chair of the Integrative Medical Science Department and the Director for the Clinical and Preventive Medicine Clerkship for the third-year curriculum. Dr. Drowis earned her DO and Master of Public Health degrees at Nova Southeastern University College of Osteopathic Medicine. She's board certified in preventive medicine, family medicine, lifestyle medicine, and medical quality. She earned her Master of Business Administration in Healthcare Administration from Florida Atlantic University in 2008. Her scholarly interests include public health, preventive medicine, primary care focused curricula, and faculty development for community-based preceptors. With that, Dr. Drowis, you can take it away.
Hi, good evening, and thank you so much for having me, and thanks for all of your help, Caitlin. It's nice to see so many people joining us who are interested in precepting and supporting the next generation of family physicians. How is the sound? Is there still reverb, or are we okay? Do I sound okay? Good, okay.
Yeah, good.
So someone let me know if anything changes and it's not going well. So I get to talk about one of my favorite subjects, which is how we can help our students through precepting and getting them excited about family medicine. I think back to my own time in medical school, and it was truly my mentors and my clerkship experience that got me excited about family medicine. To this day, I'm still very close with my attendings, with my mentors, and I will say that we make such a difference in the lives of our students, and showing them what we do and who we are and how proud we are to be family physicians is the best way to recruit future family physicians and make sure that they have a great experience. So I'm going to go ahead and share my my slides. And oh my goodness, where did my slides go? Let me make sure that I'm sharing. That didn't work. How about now? Can everybody see my slides? Okay. So we called this talk Precepting a Win-Win-Win. We want to focus on all of the positive things that happen for our patients, for our communities, for ourselves. There's so many reasons why we want to get involved in precepting, and we're going to talk through all of them and share lots of tips and resources and hopefully things that will help you to be a better teacher and to be excited about working with learners. I focus more on medical students, but certainly, a lot of this information is also relative to residents as learners. I think you just need to think about where your learner is on their educational journey. I don't have anything to disclose. I first got involved in this area as part of the Society of Teachers of Family Medicine Preceptor Expansion Initiative. So I've been involved with that for a while, which is how I got invited to present here. So our goals for today, we're going to talk about resources that are available that will help you to be a better teacher, how you can connect with medical schools in Ohio and develop beneficial teaching relationships, what that looks like. We'll talk for strategies to help students integrate within your practice to have a better learning experience and work effectively with your team and with your patients. I will be focusing on the American Board of Family Medicine Performance Improvement Precepting Program, which is something that's available, as well as other resources that are available to you, your patients, your practice, and our medical students as our future family physicians. So why am I here? Why are we even talking about this? What is the problem that we're trying to fix? And what I'll say for anybody that's been involved in medical education, there have been so many new medical schools opening up, whether allopathic schools, osteopathic schools, offshore medical schools, not to mention other medical professionals, PAs, nurse practitioners. The demand for clinical learning sites is huge. So between 2002 and 2021, just the MD enrollment alone went up 35%. So lots of new medical schools. I'm at one of those new medical schools, Florida Atlantic University, which we matriculated our first class in 2011. And, Florida had, maybe 4 or 5 new medical schools open all within a couple of years of each other. And now we're getting a new osteopathic medical school in Orlando. So, constantly more and more learners competing for clinical training sites. And, that can be a little bit scary for our deans. 84% of them are concerned about finding high quality clinical training sites. And, do we have, and 86% specifically about whether we have qualified primary care preceptors. And this is from some AAMC data, the medical school enrollment survey from 2019 and 2020. And, the reason that there is so much competition and it can be so difficult to find clinical learning sites is, as I mentioned, competition from other healthcare professionals, those individuals needing training sites and crowding out sites. DO granting schools are increasing their enrollment. MD granting schools, are often in each other's backyards and, will compete for the same, health systems or clinical learning sites. I think sometimes health systems will change their relationships. We partner with 7 different hospital systems and, one of them makes the decision to partner with someone else. And all of a sudden, we need new sites for our learners. And, I hear a lot in the physician community about whether, we should be paying preceptors for teaching or not. I'm going to, kind of put a pin in that and not talk so much about it. But, I will say that there's a lot of, pressure and a lot of people who feel that if they're going to be doing teaching and doing work, that they should be paid for it. There ends up being a lot of high turnover when we're using volunteer physicians for teaching. It's, one of those things that when things change in your life, you leave a job or you're busy changing your EHR or, something happens in your practice, the first thing that you're going to do is get rid of your teaching responsibility as you need to, kind of clear space. And it can be really difficult to replace retiring physician volunteers because sometimes, physicians who are newer in practice are just getting themselves established and don't feel as comfortable teaching right away. Competition from offshore schools, where we are in South Florida, there's, several offshore schools who will pay for training sites and, pay substantially. Their the tuition that they charge students is significantly higher and they can afford to do that. And again, this is from the AAMC medical school enrollment data. And, COVID-19 was one of those things that I think really disrupted clerkship experiences for our students. There was such a separation between, learners and ourselves, learners and patients, us and our patients. In Florida, we, when everybody, kind of went home and we were doing all of these virtual things, it became very hard to get our students back into clinical sites. And, telemedicine is here to stay. I think it's, one of those things that we have to kind of work with and figure out how to effectively teach our students how to engage with patients through telemedicine. So, COVID-19 was a major disruptor, and, one of those things that I think we're, all these years later, we're still, kind of figuring out, the best path forward. And now I, kind of want to shift gears. I hope you see that, this is a challenge. There's a lot of talk about an impending preceptor crisis. The reason STFM got involved in this area was, this question of, will medical schools have enough preceptors and enough teachers to, give students high quality family medicine experiences. And, we know from the literature that that is a great predictor of, what specialty students will ultimately choose to match into for their future career is, do they have these great mentoring relationships during their clinical learning that helps drive them toward a particular specialty. So there's a lot of incentives for precepting. I think the big one is personal satisfaction. When a student's in the clinic with me and they have one of those aha moments, or they really connect with a patient, or they're just like inspired by something that they're seeing, that is so rewarding. So, I think personal satisfaction for me is always number one on the list. I think that's, one of those things to hold on to, those connections, those relationships. Academic faculty appointments, I think, are very nice. What we started to do for our preceptors is we'd actually give them a certificate that says that, your physician is a teacher, that, they've been selected to, join our faculty. We would give them these, really nice certificates to hang in their offices to, let their patients know. We would share all of our resources with them. So access to our electronic library, journals, CME, different things like that. And, we would try to do special events for them. Our students give out teaching awards for the people that they really connect with. Or it's nice when everyone in the community comes to the medical school for a coffee reception, and all of a sudden it's like you meet these physicians that you're sharing patients with, and you read their notes and you refer to them, but to actually sit and have like a coffee and a conversation, I think getting involved in medical education is a great way for us to connect with each other. And I mentioned continuing education, just different ways of keeping up with grand rounds and just different learning. I find, when I work with a student in the practice, a lot of times they really keep me on my toes because they'll ask such great questions, and I, need to make sure that I'm, on my bringing my A game so that, I can engage with them in a thoughtful way. And then there's some other incentives like CME credit for precepting. So this is specific to if you're board certified, by the ABFM. So you can get AAFP CME credit, which is 60 AAFP prescribed credits per 3-year cycle. They consider teaching a live activity. If you're an osteopathic physician through the American Academy of Osteopathy, you can get 1 hour per 1 hour for teaching, whether you're doing that at an MD or a DO school. And you can earn up to 20% of the required CME credits every 3-year AOA CME cycle, for these activities. So if you are teaching, I think, what we used to do is we'd create these certificates with the number of hours that our preceptors were working, with our learners, and then they could turn them in and get their CME credits for doing that. The American Board of Family Medicine, something that they started to offer as a pilot, which is now here permanently. So you can get up to 50% or 75 hours per certification cycle of your required CME through teaching medical students and resident physicians. But you can also get your maintenance of certification credit, that category 4 or performance improvement credit through the ABFM. If you teach medical students, there is a requirement for how much teaching you do, and then participating in a performance improvement activity that is sponsored by an academic unit. So lots of medical schools and residency programs have signed up where they'll offer you the opportunity to participate in something that's going to make you a better teacher, and you can actually satisfy your ABFM credit for your performance improvement category in that way, which I think is really nice. People tell me that we always used to do the hand washing module. There's one for flu, there's one for COVID. But if you're already teaching, what a nice way to not only make yourself a better teacher, but to be rewarded for that. So the way that the Precepting Improvement Program works, you do a baseline assessment of your teaching performance, and STFM has provided that to most medical schools, so they'll send it to you, and then you participate in the intervention to improve teaching. Each school could decide what that looks like, and then they'll have some kind of like reassessment, and the idea being that you will kind of adopt the skills that you learn. Some of the programs will have preceptors read articles on teaching physician. At my medical school, we had created some podcasts because we have an LIC, a longitudinal integrated clerkship model for year 3. And we realized that a lot of our preceptors hadn't worked with students longitudinally. When I was in medical school, it was like 4 weeks of family medicine and 3 weeks of ER or whatever. And the fact that our students are with their preceptors for the entire year, what does that look like? So we created some very short podcasts through the Consortium for Longitudinal Integrated Clerkships and made those available. Each one, was like 5 minutes. And, there were 4 or 5 of them. Our preceptors listened to them and they got ABFM credit. So lots of different ways that schools are achieving that. It's kind of a great opportunity and a great resource. So the win for your practice, and I think that getting involved in teaching, can be great for your team and for your practice overall. So this idea of like updating your clinical knowledge, you can engage students in giving talks, whether that's for the lay audience, for your practice, for your staff, kind of keeping everyone up to date on the latest. The one thing that always makes me happy is recruiting. Many of our graduates are now in town and have joined practices where they were learning. And, I think that that's one of the most beautiful things when a preceptor says to me, I can't wait for this person to graduate and finish their training because, I want them to come and work here in my practice. And, I think when we see that, it's really special. Better patient education. You can absolutely, allow your student to create materials or find, you don't even have to create them. There's so many great materials out there. And believe me, our students are better at finding, great resources that are evidence-based and useful to share with patients. And, you can actually give your staff the opportunity to teach and to be involved in the med ed program. So, whether it's medical assistants training on, what their jobs are, phlebotomy, billing, you can engage so many different people in your practice. It doesn't always have to be you. And that can be really fun and really rewarding and, make and show your staff just that what they do is really important and engaging them in the process as well. And I'm going to share some strategies for how to reduce patient workload by engaging students. Not that we send our students out for coffee or, use them, to do the things that we don't want them to do, but there's a lot of ways that we can engage them in meaningful learning that end up, kind of helping us to streamline our patient care. And I'll talk a little bit about that. And I find like the days that I work with students, there's just like an energy in the practice. It's really fun. Patients like it. Patients look forward to it. They'll ask me about students that had been there before, what they're up to. I think they really enjoy it. We would always give out these little photos in like a clear frame that, would list the student because our students are in the practice for a year. So it would basically have like their picture and a little bio about them. So the patient's sitting in the waiting room and they've already looked at, who the student is. And, when they come in the room, they can say, oh, I saw that you graduated from whatever university or you're interested in sports or whatever it is. And it's like they have the opportunity to connect with the patient before they're even in the room. So how teaching benefits you personally. Again, this idea of enhanced credentials. At our medical school, we created a separate promotion criteria for our community faculty. So, those of us who are full-time at the university have to go through promotion and tenure, through the university process, but we had ways of recognizing our amazing community faculty who were doing a great job with their patients or doing a great job with their teaching. And, and we could reward reward them and promote them, through a separate pathway. I think, community really appreciates our teachers. We would take out an ad every year when we give teaching awards and list all the winners. We do an honor your doctor luncheon every year with the Rotary, just showing how grateful the community is for the great medical care, and that recognition that our patients are part of that they're also part of training the next generation. I think there's an opportunity for research support. Not everybody in private practice is interested in, getting involved in academics, but certainly students can pull up the latest articles and, do kind of evidence reviews and share. Sometimes, a preceptor will reach out to me that they're interested in writing or doing something, and students can be great to partner with if you're doing like a little quality improvement project, or you want to write something for one of the family medicine journals. It truly is a change of pace. Our students are there 1/2 day a week, and preceptors would tell me how much they loved that day, that it just was something that they looked forward to, those interactions, that energy. It's a chance to give back. Hopefully we all think fondly of some of our own teachers, and so that paying it forward and being that role model for the next generation, it's truly a privilege. And I think that internal reward of connecting and mentoring, I've had preceptors tell me that they've gone to their students' weddings, that they come back to town and stay, with them, that, they've just kind of built this closeness, and, that they'll get an email, from their student on match day, thanking them, that they are now going to have this amazing career because, this person helped them and, was a part of their journey. So I think, when you can make those connections, it's really special, and be a mentor for these students. It means a lot. The win for your community and your patients, letting them know that they're part of training the next generation of physicians. And, we really try to connect our students to the community. There's programs where, particularly in the longitudinal model, where, students get really immersed in, what's happening in the community. Sharing the most up-to-date information with your patients, is important. And I think, we kind of owe it to the medical system overall that, specialty choice, we want to make sure that our students are seeing quality family medicine. I'm going to talk separately about teaching in the presence of patients, or TIP, as the acronym is, because I think that's an important thing. It's an efficiency tool. It's something that a lot of us do sometimes without even thinking about it. And then I'm going to talk about how learners can add value. I've got a kind of whole section on that. So stay tuned. And I just want to see if there's yes, everyone loves their up-to-date license. That's the one that I get asked for repeatedly. It's wildly popular with our community faculty, definitely. Okay, and so how do we recognize quality teaching? So some, medical schools do it individually, but I wanted to share that STFM does it as well. For individual preceptors, there's the Master Preceptor Award. This is for any preceptor who's welcoming students and allowing them to participate in meaningful roles that are appropriate for their level of training. And if you've precepted at least 8 weeks over the last 2 years and you provide patient-centered care, then you can be nominated. And, you can nominate other people in your practice. You can nominate colleagues. I think it's a really nice, we list all of the recipients on our website. You get a certificate for your office. It's one of those just nice ways of saying thank you. And, I think that's really important, is to, say thank you to people who are doing great work. There is also a way to recognize your practice. As I was saying, if you want to engage your staff and let them know that they're excellent teachers and that they're playing an important role in this as well. And, this is about whether your office provides a culture of support for education. So, it comes from leadership that, education benefits the practice and benefits patient care. Students, are allowed to use the electronic health record. I know that can be a big thing. If you're part of the system, sometimes you need permission, but, kind of precepting a reasonable number of students, being patient-centered. I mean, I think these are things that a lot of us do anyway. And, what a nice way to recognize your practice and thank your team for what they're doing. So how do students add value? I know I promised that I was going to get to this and share. I think that this is really important. And, I know that there is a question that talks about, kind of the burden of time. And, this is kind of a way of thinking about, shifting our thinking that, students aren't so burdensome for us, that we can find ways to actually have them be valuable. So, I like to think about what activities can we have our students do. So if we, train them and, listen, the medical schools should be doing a great job getting them ready for before they even come to us. If they're third years, sometimes, we get them as first years, and it's a little bit different, during the preclinical phase versus the clinical phase. They can help us queuing orders. We can teach them about preventive care, labs, medication refills, teaching them how to get those orders into the electronic record for us, that, we kind of go over everything with the patient. They can pre-populate a lot of that. We can have them review charts in advance and look at recommended follow-up. What's missing? Has the loop been closed? Do we need results? Are there, issues outstanding? Who should come back? What we do is we'll have our students go and meet their patients at the hospital before they get discharged. So our students actually follow their own panel of patients. And if they end up in the emergency room, a lot of times they'll call their patient through their Google phone number and let them know, hey, I'm in the emergency room, and, the student can go and almost be like a communicator between like the inpatient and outpatient setting. And how beautiful is that? Because sometimes it's like, this black hole of, patients get admitted and, what happened, and they don't always understand. Same thing when they go to specialists. We can have the student go with them and, really help us to communicate. And, the student can kind of explain what's been happening in a primary care setting and, come back to the visit and help facilitate that communication. We can also, encourage our students to help us with the agenda for the visit. I feel like, sometimes our patients come in and there are things that they want to address, and then there's the things that we want to address. So it's like walking that fine line between making sure that their needs are taken care of, but, the things that are really important to their health, that, we get to those, kind of as well. So, we can use our students in that way and make sure that we're handling what we need to handle. During the visit, students can help with rooming patients, doing vital screenings if there's developmental or mental health screenings that we want them to do, prepping any paperwork if there's forms for, school physicals, employment, medication reconciliation. There's a great module that I'm going to show you guys that trains students how to do a medication reconciliation. I think that's a really important skill, particularly after people are coming out of the hospital, just to make sure that everybody's on the same page. Updating a problem list, again, preparing orders in the queue, and they can also complete clinical summaries. You can train your students to kind of have all of that, ready before you go in the room. They can give immunizations, help with blood draws. They can identify patient education materials. Our students are amazing at that, finding great resources. You can ask them to give common patient education talks. If you're seeing a lot of, URIs or, constipation, whatever it is, you can, kind of have the student practice and, give those talks to patients. Motivational interviewing and patient education around common topics. There is also, I mentioned the module on medication reconciliation. There's one on motivational interviewing as well. So, engaging our students in those types of conversations can be very helpful. This last one about documenting care in the AEHR. When I was a medical student back in the dinosaur ages and we had paper charts, we used to, write everything. And my note was, essentially the note. The attending would just write, kind of read it, make sure everything was good. If they, needed to change something, they would, but it was always, kind of agree with above. And then, the pendulum swung the other way, and it was like, no, we can't have our learners doing documentation. But, actually under the preceptor initiative, STFM lobbied, and now documentation from medical students can count. So I'm going to share a little bit about how that works. So any individual who's authorized under Medicare law, acting in a teaching role may review and verify signing and dating the medical record for the services they bill rather than redocumenting. So this is, any record you have to kind of review it. You are responsible for it, but certainly in primary care, you can have your students document and just verify that what they're saying is accurate and have their note be the note. And I think that's really great because they need to learn how to write notes and to write notes well. And there really doesn't need to be two notes. There can just be one kind of agreed upon high quality note. And this is the the Medicare change. So this was kind of a big deal, and I think really important and really helpful. After a visit, if there's questions in the portal, you can have the students monitor that and respond to patients. You can have them calling patients to follow up after visits and see how they're doing. Participating in care coordination, if you'd like them to go to a specialist visit, any pharmacy procedures or home visits. We, in our clerkships, give our students what's called white space time, where they have actually open afternoons, and we expect them to be, going to things. And, I used to get an email from students who'd say, hey, my patient's going into surgery. They're having, a Whipple on my preceptor, morning. I would like to change, my preceptor said it's okay, and I would like to go into surgery, with my patient. So lots of opportunities, lots of, ways for students to learn, in a variety of settings. They can help with calls, making sure that, things are kind of moving forward. If they need help with, social work, ancillary services, and community resources, students can be great at identifying resources for our patients. So a little bit about efficiency, some kind of general principles. I just want to say that I don't think students need to see every patient. We should be kind of moving at a clip where, we're going to get through our day and, not be seeing patients until 8 p.m. So, we can kind of handpick which patients we would like our students to see. I'll sometimes huddle with them in the morning and kind of look down the list and say, okay, this is a great patient for you, set the student up, and I'm in the next room seeing a patient. And then, I can go back and, kind of finish up with the student once I trust them to do that. But, there's a lot of ways of, wave scheduling, different things that you can do that, let the students really engage deeply with just a few patients and learn about those rather than trying to see everybody. And then, it kind of gives them the opportunity to follow the patient through, their entire visit rather than, just feeling like they're, kind of going from room to room. This idea of teaching in the presence of patients. So this idea of, kind of thinking out loud, of explaining your thinking to the student while the patient is in the room. And this is a really nice way of, what I found is that patients love it. They love when they're part of the conversation and part of the learning, and you're teaching the student, but you're also teaching them about their disease and teaching them about why you're not worried about this particular diagnosis and, what the next steps look like and, of the things that you thought about. It can be really nice for the student to learn it. And rather than stepping out of the room and then saying it to the student and then having to come back in and have the conversation with the patient, you can do it all at once. And it's a really, really beautiful thing. And, certainly there's those times where you just need to kind of power through, and you may say to your student, hey, I'm going to have you spend the next half an hour, with the medical assistant or, with the nurse, whomever in your practice, a PA, they're going to teach you some stuff, and I'm going to go over here and see some patients. And that's, totally okay as well. You can also work with multiple learners. I think, this is a great strategy. If you have two students at the same level, you can schedule more patients. And, I have one preceptor. He gives each student their own laptop, and he, kind of sets them into different rooms, and he, is kind of going, if you have going between them. If you have students at different levels, you can pair them, have a junior learner kind of be the historian, and the senior learner scribing for them and, giving them feedback. So, lots of different ways to have students together. I will say, at least with the LCME, there's an expectation of, not having learners from multiple programs, that you really kind of have to be focused on what their curriculum is. And, it's important that, a lot of times the, preceptors can schedule students on, different services or different dates. There's a lot of ways to make sure that the students are getting the experience that they need and, that will satisfy the LCME. For us, it was easy because it was a half day a week and we could kind of say, okay, this is our students' half day where they're the priority. And, that works really nicely. I think it's harder in block rotations. But again, like if you know that your student has didactics a certain day, there's ways of scheduling so that you don't have so much crowding, and it just takes a little bit of thought and sometimes a conversation with the medical schools where they have to kind of adjust and be a little flexible. We found that having our third year didactics on a different day than our first and second year didactics opened up, some slots with some of our preceptors. Students in telemedicine. So how do you teach in telemedicine? There's a couple options. You can have the student observe you and they can write a note. You can have the student obtain the history and do, the appropriate parts of the physical and then present while you're observing with you writing the note and inputting the orders. Or you let the student speak to the patient first and take the history, and then you join, listen to their oral presentation and observe them do the physical. So this is kind of teaching in the presence of the patient, telemedicine style. So just a couple options of ways that you can still integrate students with telemedicine, because I think that's just something that's going to be in our practices. It's here to stay. So lots of resources that are available from the Society for Teachers of Family Medicine, and most of these are not behind a firewall, so you don't have to be a member to access them. Obviously, if you're interested in teaching, it's a great organization to be a part of, but these are all available. You can point your students to them. You can use them yourself. So there's all these kind of modules that were created. One is called How to Be Awesome in an Ambulatory Clinical Rotation. And this is a handout. I think I shared it. For students to use. It talks about how is inpatient and outpatient care different? What do we do in a traditional primary care practice? How to be effective in oral presentations? What are the core features of a wellness visit? These are things they're going to see over and over. What do chronic disease visits look like? I think we do a good job of teaching our students to do, SOAP notes and handle acute complaints, with an HPI. And it's a little bit different, when you're doing a lot of chronic disease care or wellness visits and you don't, have that, kind of traditional HPI. And then some tips for maximizing learning. I really believe that, our students should come engaged with, some thoughts about what do they want to learn, and there's nothing wrong with asking them, hey, you're here for the afternoon. What are your goals? What are, some things that you've been learning on your other rotations? What are things that I can, help you on this particular rotation, that you'll get out of this experience? Because every clinical experience is different. And, I don't believe that just because our students aren't going into family medicine or they're not going into primary care, our visits, our time that we spend with them, like this is how they learn to take care of patients. It's bread and butter, and they, they have to kind of be there and to be a part of it. Yes, and we'll make sure we get you that handout. If I didn't include it, I'll make sure that I send it to you, Caitlin. Thank you. And some other online training modules that are available for students they can watch. These are like actual modules for them. How to write a high quality note in the electronic medical record. Medical schools should teach students how to do this, and they should have some practice in this before they get out on third year, but this is a great reminder of how to do that. How to perform a medication reconciliation, what does that look like? And then motivational interviewing, a structured approach to behavior change. So these are specific tools that are available for our students, and I put the link to them. So, certainly share them with students. We encourage, medical schools to share these and have their students, kind of do them in advance of starting clerkships. There's the student passport. So this is something that STFM created that I love. It's a nice way to just know like who your student is and where they are. So it's got a little bit of like their basic demographics, who they are, where they're from, but their personal learning objectives. And again, like that expectation that the students thought about it a little bit in advance. Why are they coming every day? What are things that they want to make sure that they get out of the rotation and learn? And then what about them can you connect about? If they love love, college basketball and, you're going to be watching March Madness and they can come in and you can talk about your brackets and, what's happening. It's just a great way to connect. So, knowing a little bit about them. And I think knowing, what rotations have they already completed can be really helpful. If they've done surgery and they're great at suturing and a patient comes in who needs suturing, you can supervise them suturing. Or, certain procedures, let's say they've done their OBGYN rotation already and they're very comfortable with pap smears and you want to watch them, do some pap smears. Knowing what they've already been through and what they feel comfortable in can help guide you. If they've never even seen a pap smear before and their first time, watching one is going to be with you. That's also really helpful to know. And then just, kind of verifying that they've been through, those modules. We put that on there as a resource to kind of like cue the students, hey, these are helpful things that you can learn and, bring with you. And they can actually download this. They put a little photo of themselves and it's just a nice thing that they can send to you before they get started. So, so that you can look, have a sense for who they are and where they are. So they download it as a PDF and there's a little confirmation of readiness for clinical work. And if they, send it to their clinical coordinator, you can have the coordinator send it to your clinical site. So, you can share it with your team and, get your team excited to meet the student. So, when they come in on the first day, everybody knows who it is and that they're supposed to be there. So who is interested in teaching? Hopefully some of you. I took a look at the schools in Ohio and there's lots of them. So, I'd imagine that if anybody isn't already teaching and wants to, that, all of these schools would be more than happy to connect and get you involved with their learners. There's allopathic schools, there's osteopathic schools. Sounds like Ohio's got amazing medical education programs and great opportunities to connect. So with that, I will take questions. I think I'm right on schedule for, I wanted to leave time for questions. That's my email. You're certainly welcome to email me if you have questions, thoughts. Anytime. I'm always happy to connect. I'm on LinkedIn. I've, kind of gotten off Twitter and, some other things, but, you can email me, you can message me on LinkedIn. I'm always happy to chat about education and learners and family medicine, all things that I love. This is the link to the STFM Preceptor Expansion Initiative. All the resources and everything that I shared are there. We love this article, A Bonus, Not a Burden, How Medical Students Can Add Value to Your Practice, that Annie Redder from STFM worked on. It's in the FPM and it's available. And I think we provided that one as well. If we didn't, we'll make sure that it goes out in the email. And some additional resources, just kind of how we got going, responding to the community preceptor shortage, different articles and just different resources related to all of this. So I will stop there and I will look at the chat and I will look at questions and you can certainly add more. And yes, students do get free access to STFM. It's kind of like AAFP. And I tell all students, AAFP is amazing to join, because you get American Family Physician. I don't know if you guys loved it as much as I did when I was a student. I loved it so much. I'm actually on the editorial board for it now because I think it's just an amazing, clinically focused, relevant journal. So I feel like I always push students towards AAFP. But yes, STFM is available and free and offers them scholarships. For students, STFM does a really nice for third and fourth years where they can get an award and a scholarship to travel to the STFM meeting. It's one of those nice things to put on their resume when they want to match into family medicine. But yes, definitely tell your students to join STFM because we would love to have them. What else did I miss in the chat? So nice to meet all of you. Okay, I'm going to look at the questions. So many potential preceptors are overwhelmed. Individual school guidelines, learning objectives, syllabi. How do you reassure preceptors that they can still teach without necessarily dedicating significant time to the academic machine of a medical school? You know, what I would say to that is that's really the job of the medical school to cover, curriculum is sort of like a top-down thing. You know, we create it and we make sure that our students are covering all of those things through didactics, through, OSCEs, through kind of a set, list of experience that all students have. So that's really on the medical school. I let preceptors know that their job is to really do what they do in the office, to role model that. You can be a great teacher just by caring and engaging. There's great little, snaps and, giving feedback and all of these ways of kind of like engaging with your learners that are out there. You don't have to get into the chaos of like, what is the curriculum and, what does the plan look like? Your job is to, take great care of your patients first. And, you're really like, not to say that med ed is just an apprenticeship model, because I feel like we've come so far to, make sure that it is robust and well-rounded, but that is really on the medical school and on the clerkship directors and, and the programs to carry that weight. So hopefully, preceptors know that they should be, kind of working the students into their regular flow. And, some preceptors will say things to me like, well, I'd like to see one less patient on a day when I know that I have the student so that I have time to do some, dedicated teaching, but you don't have to, especially if you're going to teach in the presence of patients. Or, it's okay to say to the student, listen, we didn't have time to talk about this today. Go home, find a great article about it, email it to me, or, we're going to talk about it next time. Like, that's totally okay as well. Any books you recommend for teaching? So do you mean like teaching family medicine specifically, or do you mean like how to be a great teacher? Giving feedback or any resources related to this. So there's a ton through STFM. STFM has a resource library. And if you were to go in there and say feedback, you'd find tons of things. I'll send some out in the email, just some great things that we share with our preceptors about, giving feedback. My favorite resources on, teaching and education and how learners think, we work with adult learners, it's different than, than children. So, experiential learning is so important to them, and, make it stick. And, like that's a book that I read that, got me really excited about teaching. I had, I'd gone to Harvard Macy course for educators in the health professions, and they do a journal club where they're always encouraging us to read articles about, Kolb and just how to be a great teacher. So there's a ton out there. If you want specific recommendations, feel free to email me and I can share, tons of resources and tons of ideas. And yes, I am preaching to the choir because you're here on a Wednesday night because you care. And it is so hard, when a student says to me, like, I decided on day one that I'm going to be a plastic surgeon, and, this is just, I'm passing time. I have to, kind of be here. I kind of like see those students as first of all, many of those students do end up changing their minds. They come in and they think that they want something, and, then they get to it and it's like not at all what they thought. Or for some of them, they're just not competitive enough. And, that's the reality. So like the match is so different now, and it's very, very hard for these students. They're under a significant amount of stress. And I just let them know, listen, you're here to learn and you're here to have fun. And if you're not interested in primary care family medicine, like you still need to learn medicine. You still need to learn how to interact with patients and how to take care of them. And, I'll say to students, like, if you're interested in, and when I used to assign students to preceptors, like if I knew that I had someone who was interested in OBGYN and one of my preceptors does a ton of women's health, I'd be like, I'm going to put that student with that preceptor so that they could see, that women's health is a part of family medicine and they could have, more experiences. And so they'd end up like really enjoying the rotation. And so that was part of what we would do is ask our students, like, what specialties are you considering? And, I'd have preceptors that did all kinds of things, sports medicine, sleep, addiction, whatever it is. Family medicine is so broad and amazing. And, and I think we have to show our students that is that like, there's all of these different areas. It's all family medicine. And so, whether they're interested or not, I'd see it as a challenge and, make sure that they're not just, standing in the corner studying for, whatever it is that they actually want to do and that they're there. And, if there's an issue with professionalism, I mean, I've definitely had, that one student who would call their preceptor and say, oh, there's really important surgery, I'm not coming today. And it's like, no, that's not okay. And when there's, professionalism issues, again, that's on the College of Medicine. And I'd make sure that, preceptors know, like, just tell me, because guess what? I'm going to be showing up in your office randomly. Like, and I tell students all the time, like, hey, when I'm in the neighborhood, I stop by and visit and see what's going on with your preceptor. And, that'd be an office I'd stop into and say, wait, where's your student? Like, so it is on the medical school to kind of manage that. But all that you can do is just show how amazing family medicine is. How do you manage when patients have no interest in student participation in their care? Yeah, I mean, that's a hard thing because our students have to learn, but I would never force a patient to have a student involved. And I would just say to the student, you know what, I'm going to go see this patient alone. And, I'm at the university, so we have that luxury. All of our patients sign that they know that they're going to have learners involved in their care. But sometimes there's something private where, a patient will say to me, I really don't want to discuss this in front of a patient or in front of a learner. That's okay. And I'd say to the student, hey, this is the time I'm going to have you work on, your blood draws, go over to the lab and we'll see the next patient together. So, that idea that they don't have to see every patient, you can kind of navigate that. And, sometimes I know just in the morning by doing that huddle and kind of being prepared, okay, this patient, the first patient after lunch is not a patient that ever wants to see a student. Tell the student to take a longer lunch or, come back from lunch 15 minutes late and then, see the next patient. So totally ways to get around it. It's not ideal. I had a colleague who's an OBGYN and he had this great, checklist where it was like, rather than saying to patients that you wouldn't have the student involved at all, it was like giving them choices of what can the student be involved in. And, I thought this was really cool for OB because it's like a lot of people say, oh, I don't want the student there for my pelvic exam, but, they could do the history or, they could do a Doppler or, whatever it was. And so we would kind of give them some choices. And sometimes that's a really great strategy for saying, you'll meet the student. And then like once the student got in there and the patient realized like how professional they were and how, how great they were, then they wanted them to stay. So I think, sometimes just opening the door and, getting them involved in something, it's funny, like I live in this area and our students are all over the place. And sometimes like I'll go to, a pediatrician with one of my kids or, whatever it is, and a student is there and they'll look at me and they'll be like, oh my gosh, I'm so sorry, I'm leaving. And I'm looking at them like, don't you dare, like, you got to learn this, come in the room, take a history, like, talk to me like I'm, a parent or I'm your patient, whatever it is. I think just, reminding them that they are professionals, that they, that they need these experiences. So I think I got through most of the questions. Are there any other questions that you guys want to answer? That you guys would like me to answer, or anything you want to share in the chat? Any tips that you have that I haven't covered?
Alrighty, I'm not seeing any questions or additional comments, but we'll just wrap it up then. Thank you so much, Dr. Drowse, for that wonderful presentation, all of the resources, tips, and information you provided. And thank you all for joining us and sharing your time with us tonight. If you are ready to jump in, the OAP Foundation is in the thick of recruitment for its flagship program, Leroy A. Rogers Preceptorship Program. We work with all 7 medical schools in Ohio to implement a 4-week family medicine rotation for medical students just completing their first year of medical school. So right at the beginning of that journey. If you're interested in learning more, just send me an email. There's also a question in the program evaluation where you can check, want more information. We'd love to just share more information, even if you're not ready this summer, but maybe we could reach out to you in future years. We're hoping to have about 70 students participate this summer, following continued success and similar numbers that we've had since 1990 for this program. So we'd love to have you all involved if you're not already. Finally, as a reminder, tonight's session was approved for 0.75 live AFP prescribed credits. Once you fill out that program evaluation, I can send a CME certificate for your files. You'll need to report your credit on your own in your AFP profile. And then I'll send that email out after the session with the evaluation link, some of the resources we shared, and then I'll include Dr. Dorales on there as well. So if she has additional information or links and resources, she can follow up and send those to you all too. I think that is all. Thank you so much. Enjoy the rest of your evening, and we will have this recorded session. I'll send it out to you as well once it's ready, and then it'll be on our website too. So thank you so much, and good luck with your precepting, and thank you so much for all you do for this next generation of family medicine students.